we can all work together. Thank you. How we can all work together to build strong families. So we're really exciting to see such a broad range of people and communities here with us today. So thank you and welcome. Um, Brianna, can you go to the next slide? I actually think you can go to one further. Want to start just real quickly to talk a little bit about Text for Text. For those of you that don't know us, we've been around for about 20 years. We are an organization that has a long track record of working on public policy and systems change, and also on local implementation. And so what that means to us is we help support providers through a variety of different ways. And so that is how we interpret policy implementation. So we're happy to see some providers here today. Welcome. And that's about Text for Text. If you want to move to the next slide, and I'll tell you a little bit more about how we actually put that into action. So in addition to doing advocacy and focusing on systems change, we also try really hard to raise awareness about preventative solutions and evidence-based strategies. We convene several different collaboratives and are part of several different collaboratives. So I hope that many of you today, I believe some of you today are part of the Child Protection Roundtable. If you're not, please feel free to reach out and let us know. We'd love to have you join that roundtable. It consists of about 80, I think it's over 80 organizations that work together, meeting once a month, all around child welfare issues. So we'd love to have you as part of that. We also have a terrific network that I believe some of you are also part of called the Texas Prevention Network. We've got, I think it's 200 plus, 240 plus organizations from across the state that are part of that. So we have virtual learning sessions. So we'd love to have any of your organizations that you work with, any of your partners, any of yourselves that work on strengthening families and supporting families. We'd love to welcome you to the Prevention Network. So just let us know if you're not already part of that. Over our history, we've advocated and successfully passed 54 bills, all focused on strengthening families, and secured quite a bit of money for home visiting and other preventative programs. Next slide. We wanted to start today by laying some context before we get to our panelists. We've got some great speakers here today, but we wanted to start this morning by laying a little bit of context. You might know some of this data. I think it's really important just to start with this, but 1 in every 10 kids in this country, over 10% of the children in this country live in Texas. That is mind-blowing, I think, for folks that don't know that already. So what happens here, they always say what happens here impacts the country. And it really is true when it has to do with children. On the downside, I mean, what we're here to talk about today is strengthening families so that we can prevent abuse and neglect. This statistic is from 2023, 58,120 confirmed victims. That is not the number of investigations. That's not the number that call in for the hotline. It is actually the number of confirmed victims, which is just overwhelming. It is nearly to about 180 cases a day, confirmed victims a day. So it really is overwhelming, especially when you think about the fact that 4 in 10 calls that come into the hotline don't actually meet the threshold for abuse and neglect to warrant an investigation. And when we look at that data, it really is obvious that so many of those calls that don't meet the threshold for investigation actually represent families that are looking for support and or in need of support, right? A home visitor or a pediatrician or a teacher calling in because they know of a family that needs support. They are worried, but they don't meet the threshold of neglect. And so that doesn't warrant an actual investigation. So that 58,120 confirmed victims is overwhelming, but to think about the fact that 4 in 10 calls to the hotline, there are even more families than that we know need support in order to avoid a crisis. Can you go to the next slide, Brianna? Thank you. We always feel like it's important to start to talk about the child welfare system as a whole. We view it kind of in a continuum of prevention, early intervention, and system involvement. You can see in here the numbers from our perspective, the potential numbers of that could benefit from preventative services. If you look at the whole world of all of the children in our state, 7.7 million children in our state, the state funded services, PEI, the Department of Family and Protective Services, their prevention and early intervention funded services actually serve about 66,000 children annually at a cost of about $2,000 a child or family. That continues up through the system. If you look at early intervention, so once an investigation is open and the services that are provided in the investigative phase, like FBSS, family-based supportive services, that cost goes up and the numbers go up. So it's about 555,000 children are involved in investigations. And then the final bucket of the system, child welfare system, really is system involvement. That is post removal, after children have been removed from the home. And there are about 31,000 children in that part of the continuum. And that is the most expensive cost, obviously, at almost $33,000 a child per year. So if you multiply that out for how long a child is in custody of the state, it is much more costly from our perspective than if you were to go downstream and intervene, which those dollars are actually a one-time intervention or preventative support service to a family, which is much more beneficial cost-wise. We do, the child welfare system is a very complicated system, and it is kind of the intersection of a lot of different systems. And it also, sadly, is often the system involvement part of it. The time when children are in care is really often when other systems have failed those families, right? So kids have been in different systems, whether they're in the healthcare, touched by the healthcare system or the education system, and all along something has gone wrong and we haven't been able to intervene. And then that is the final interaction of the removal from the home. So we wanted to lay that context today when we talk about prevention and the prevention ecosystem. This is what we're talking about, the continuum here. Next slide. I'm going to pass it now over to Carrie, who's going to talk a little bit about the ecosystem.
Thanks, Adriana. Gosh, so thankful that so many of you have joined us today. For those of you who we haven't had the pleasure of meeting yet, my name is Carrie Giudice. I am the Director of Policy and Advocacy here at TextProtects. I have been working in child welfare for about 16 years. My time started in the field. I was a CPS caseworker. Then I worked a little bit behind the scenes dealing with placements, trying to make sure kids had appropriate placements when they were in care. And then I did a little bit of a stint in the Senate. And then now I'm here at TextProtects, been here for about 4.5 years now. But really, I've always been focused on children and families because that's really where my passion is. And I'm really energized about the conversation and efforts that are currently happening to make sure we have strong families here in Texas. And I'm really excited to share what we at TextProtects know and for y'all to hear from this really wonderful panel here in a little bit about what that looks like. But perhaps I think it would be helpful for us to just kind of start with some basics, make sure we're all on the same page about what we're talking about here when we say the word prevention. The way Texas has typically talked about prevention has been specific programming or services that have outcomes related to preventing child abuse and neglect. And PEI that Adriana talked about earlier, really they've been the ones who have been charged with ensuring the state has that array of prevention programming by providing grants to communities to provide those services. And PEI funds incredible initiatives that are shown to be best practice. It's programs that have been rooted in research and evidence and have really been proven to work to ensure children are safe and to keep families together. And that's things like home visiting. It's things like family resource centers. It's a lot of the programs that many of you who have joined us today offer in your communities. And we absolutely want these kinds of prevention strategies to continue, but this conversation has really started to shift in a super positive way, both in Texas and nationally, to think more broadly about what it means to strengthen families. Is really any efforts to strengthen families are efforts to keep children safe and keep families together. So what do we mean whenever I'm kind of using this phrase of we're thinking more broadly about it? We believe that these services include things like evidence-based programs and initiatives that PEI offers. But Brianna, if you could go ahead and progress that slide. I want you guys to see this. But we also know that sometimes what a family needs to avoid crisis could look like one-time rental assistance to keep a family from losing their home. It could be a referral to a food bank to make sure that they have plenty of food that they can put on the table for their kiddos. It can be helping find employment or things like childcare, substance use treatment. Really, what you're seeing on your screen here, it's just this, it's this array of different programs and services and supports that really come and wrap around the family to make sure that they are healthy and safe and can remain together. And so we really believe that, families can benefit from communities that offer that continuum, that array of services, of family strengthening services. All right, and Andrea, I'm going to go ahead and pass this over to you.
Okay, unmuting myself, sorry. Hi, y'all, I'm Andrea Sparks. I'm with Buckner International and also am honored to be the Public Policy Advisory Committee Chair for Text Protects this year. For those of you who don't know me, I was just doing the math, 25 years in advocating for children and families, from a baby lawyer representing children in court, families in court, foster care cases, juvenile justice, adoption, to working for Texas CASA for 10 years as the public affairs director, and then working for the National Center for Missing and Exploited Children, and most recently, the governor's office, leading the child sex trafficking team. I am so excited to be part of this discussion today because this is really where I'm focusing my career now, which is upstream solutions to strengthen families and prevent the kinds of harms that happen when we don't have strong families. So I get the distinct pleasure of introducing and facilitating this panel discussion today, and I want to introduce our panelists real quick. So they're on here. I don't know how this is going to work on Zoom. I've never done a panel on Zoom, but we're just going to make it work. So Joy Boris is here. She's the Associate Commissioner for Family Health Strategy at the Health and Human Services Commission. She is tasked with working with partners across the Health and Human Services Commission and externally to support positive outcomes for Texas women, children, and families. She's been with HHS since 2013 and has worked in government relations, health and specialty care, health development, independent services. Prior to being at HHSC, she was a staffer in the Texas House and worked for several NGOs. She earned her bachelor's in social work from TCU and says go Frogs, and a master of social work from University of Washington. And we've also got Sasha Roscoe, who is currently the Associate Commissioner of Prevention and Early Intervention at DFPS. She has been in that role since 2013 and has overseen over 140 community-based grants to organizations providing an array of services to strengthen families and keep children safe in home, and has just had an amazing career in child protection, in child care licensing, and infant caregiving, and is now moving over to HHSC as part of this consolidation that we're going to talk about today. And we're so happy to have Kylene Wright with us today. She's the President and Chief Executive Officer of Texans for Life Coalition. Kylene says that she has been a pro-life activist since she was a freshman in high school in 1975. I shouldn't have said that, but we love you, Kylene. That's awesome. And when she first started hearing about abortion and learning about it, she has been the president of the president and CEO of Texans for Life since 2000, so 24 years. It's amazing. She's passionate about protecting both babies and mothers, and as a single mother herself, understands much of the kind of help and support that struggling moms need. And we're so happy you're here. And she is not Andrea Sparks, so just ignore her name on the screen. She's using my link, but that is Kylene Wright. And last but not least, we have Candace Gray, who's with Buckner, where I work. She is the director of our Buckner Family Hope Center model. And Candace has been at Buckner since 2010. She served in various capacities, but now is focused on strengthening families through our Family Hope Centers, which are our version of family resource centers. Candace, in true family strengthening fashion, doing the work on the ground, is in her car right now, and I'll let her explain in a minute why, but she's actually doing some things for families and youth in San Antonio as we speak. And she has to leave at noon. So if we have questions for Candace, we'll try to get to those ahead of time before she has to leave. So I want to start with just, saying that from my perspective at both Text for Text and at Buckner, Senate Bill 24 is a huge change and a huge move forward in the strengthening families space. We actually were advocating for some of the changes in Senate Bill 24, but specifically, one, the funding, the huge amount an increase in funding, historic amount of funding for both the Alternatives to Abortion program, which was renamed Thriving Texas Families, as well as PEI programs, which are family support services. And that's huge. We know we have like Adriana and Carrie was saying, we have a lot of kids in the state and a lot of families who need help. And we want to keep them safe at home. And two, it broadened what it looked like to support families. And for us, that really makes a lot of sense. In other words, not just focusing on preventing abuse and neglect, but focusing on supporting and strengthening families to include things like economic sustainability of families, economic stability, and family formation. And it required a strategic plan for family support services, which hopefully we'll hear a little bit about today from Joy and others by September 1st of 2025. So it also put in statute what I talked about earlier, the Alternatives to Abortion program, which had been an appropriation that had continued to grow thanks to the Texas legislature, but now it's in statute. And Kylene's going to talk about what that means and some of the improvements that were made to that program by adding it into statute. So without further ado, I just wanted to see if Joy and or Sasha could give us kind of an overview of like, what is your understanding of the intent behind Senate Bill 24 and how it may change things and how it is changing things?
Thank you. And thank you so much for the opportunity to be here. We're really excited about SB 24, the implementation, the intent behind it, and some of the opportunities it might offer for existing HHSC services as well as current PEI services. So when we're thinking about the intent, we're sort of listening to all the public testimony, how Senator Cookhurst laid it out, really trying to get a feel for what the state leadership and people on the ground really need from a system to support families. I think the intent, there's a couple of goals in mind, one of which I think is about driving efficiency and coordination and just making sure that the state is operating as seamlessly and nimbly as we can. So I think that's a huge goal, is just making sure that the programs at PEI are aware of the programs at HHSC and how do we sort of fit together and making sure that we're not duplicating efforts, things like that. But I think there's a larger goal at play in SB 24 to really make sure we're being strategic as a state and we're driving all of the resources we have towards shared outcomes and goals, especially when we look at the broad array of services that all serve this population. So I think, they want us to coordinate with each other, but I see SB 24 as an opportunity, not just to coordinate, but really to collaborate, to really have shared resources and shared vision and kind of put our money our money where our mouth is, literally, when it comes to serving families. I think that we can look at the goals in SB 24, especially around how they codify Thriving Texas Families, some of the outcomes they want to see from that program specifically, but sort of extrapolating that to our other programs that might provide similar services or serve similar populations, and really trying to take a more holistic view about how we as an agency or a state are serving these populations, rather than having a collection of programs that may be doing different things and not really working together as well. I think if I was sort of refreshing my memory, looking at the bill analysis this morning to prepare for this, and it specifically talks about a desire to intervene in the cycle of poverty and wanting to work toward a future where families are stable. And I think Andrea, y'all mentioned this desire for economic self-sufficiency, and I think that's a huge part of SB 24, and maybe something that we've sort of been working at the fringe on, but really trying to have a plan to move families who may need our services at a given point in time, really helping them to stabilize and then live their life fully in a more self-sufficient way. So I'm really excited about PEI coming over. I think this gives us an opportunity to look at the full spectrum of both social and health supports that we as an agency offer, the way we work with agencies like TEA or the Workforce Commission, to really look at how we can better come to the table with our partners for the good of families. I think one of the things that will be exciting but also difficult is just acknowledging that every family is unique and has really unique needs that are going to change over time. So, when we think about achieving the goals and intent of SB 24, having some strategy around how are we supporting families at any given moment, when and where they need it, to really achieve those long-term goals of family stability, economic self-sufficiency, ultimately this end to generational poverty. It's daunting but exciting. Sasha may have other thoughts from her time negotiating downtown, but that's sort of from an HHSC perspective what we're really excited about.
Sasha, do you have anything to add about that?
I mean, I think Joy did a beautiful job laying it out. I mean, I can only give a little bit of perspective from just maybe the intent and moving PEI particularly. I mean, she spoke much more broadly about Senate Bill 24, which is much broader than just moving PEI, but clearly, we had been positioned as sort of a prevention arm of child welfare. And my understanding of the intent is, at least in our moving over, is that families do need a lot more than the parenting programs that PEI was offering, and that what the PEI programs and the community organizations providing those at the local level, what they're doing is much, much bigger than just preventing child abuse and neglect. They are, really supporting families to be healthy and have strong relationships with their children and develop skills and connect to other resources in the community and build their social support network. And so it's just, and I think, in a more, like, maybe in a little bit more of a boring sense, but DFPS is largely a workforce agency that supports staff out in the field doing a very legal job. And HHSC is an agency that supports lots and lots of contracted services. And that really was the business model for PEI, and it did make us a little bit unique in relationship to child protective services and adult protective services at DFPS. And this is a better fit in terms of continuing to support community, connecting the dots for families. Because if we really want to prevent child abuse and neglect, we want the PEI programs to be more connected to the kinds of programs HHSC is funding, like SNAP and WIC and ECI and Medicaid, to avoid it and less connected to CPS. That's the whole point. So I think that's the only thing I'd add is in terms of a more telescoped view of the PEI move, is that it was really to focus on child well-being and family well-being promotion, and less about preventing a bad outcome, which does have somewhat of a negative connotation. I mean, but I will say, I don't think that was ever what the community organizations providing PEI programs were doing. As you well know at Buckner, because you all provide, you're a big provider of PEI programs. I don't think that was the client's perspective when they received programming, but at least just in how it was laid out at the state agency level, it's a better, more positive reframe.
It is exciting. It's like really, moving our state upstream. And I love that. So given that, what changes should we be looking out for? What are there going to be changes to how services are delivered? Are we going to change categories of different kind of grant programs? Do you foresee any of that happening?
Well, I can speak to the PEI part, and then maybe Joy, you can jump in if there's anything outside in the family health array that, but first of all, someone just asked, yeah, thank you, Carrie. Prevention, PEI stands for Prevention and Early Intervention, and that was the division name set in statute, which has already, been eliminated. So when we move to HHSC, we will be the Family Support Services Division. And I think some of the changes to be anticipated, we already laid out in the expansion opportunities. You spoke to the historical expansion of funding, and that was laid out with the new statute and the new direction in mind. And some of it, I think some of that is to allow more flexibility at the local level to try interventions and programming besides some of these larger sort of proprietary evidence-based programming. And so it's to provide more flexibility for innovation, but also, as Joy mentioned, to promote economic self-sufficiency in particular. So we did highlight and emphasize and encourage a lot more movement there. And what I think we've already seen in the expansion that's happening, both with our existing grantees that had capacity expansion and in the new grants that have been set up under the expansion, are things like resume building workshops or job interview prep or, financial literacy courses or partnerships with credit unions on opening bank accounts for families, and just a lot of navigation for families to get other services and connect to resources they may need. Because I think we all want a no wrong door approach, however a family comes into contact with someone who's going to help them, church or neighbor or school or service provider. We want them, if what they really need, I think to the point of the slide Carrie laid out was, maybe childcare, or we want them to be navigated to that first, and we want their first needs to be met and not necessarily to just be sold a program that happens to be the one being provided by whomever they encounter at the moment. So that's the way in which I think we've emphasized the self-sufficiency component. And then I think to the bigger point of Senate Bill 24, I don't know that it's a change, because we have always encouraged, local collaboration in the work that we do, and sort of that kind of really and focused community collaboration, results-based accountability, and some of what we're funding in partnership with TEA and TWC through their preschool development grant, those early childhood systems building work. But I think a lot more encouragement of slotting the programs that PEI is funding in this broader context of what HHSC is providing. So we've done a lot more encouraging of partnerships with HHSC programming. We've seen some co-location of WIC clinics, and we already had a good bit of partnership with ECI programming, but maybe even some more discussion of how PEI programs can pick up those families who maybe aren't eligible for ECI, and wrap around that population. So lots more specific coordination with HHSC programming. Those are the big, I think, emphasis shifts that we've seen so far. And of course, we move over on September 1. And so I think, the sky's the limit. I think you'll just continue to see more thought about what it means to present these programs in the context of a larger family health network.
So, so kind of streamlining and connecting the programs so that families can get more of their needs met. Is there going to be a strategy that kind of lays this out? Are y'all working on something that people can review and kind of learn from, or is this just kind of happening organically?
A little of both. Joy, you want me? I'll start with our strategic planning efforts, and then you can jump at same thing. Like I'm the smaller portion, and she can talk about the bigger picture. I mean, first, I think you've already seen to some extent an organic beginning in just the conversations we've had with grantees and the RFAs we've already put out, some of them under the auspices of HHSC because, you know, and just the things that we've emphasized that I already talked about as sort of the beginning of this newer framing. But there is also a strategic plan required that is due next September. And I think we're sort of taking that in two parts, like family support services. I'm going to start using that term. We'll develop one that speaks to just how the programs in Chapter 137 of the Human Resources Code that kind of groups all of those programs together. How are those going to be threaded together? What kind of outcomes are we going to drive toward? How are we going to lay out those programs and measure effectiveness and all that? We'll be kicking off that work once we get over to HHSC and involving our current grantees, clients of services. You know, we really emphasize listening to the clients we're serving. We'll be working with you stakeholders like you all, and opening that up for feedback. And then that strategic plan, once it's published, will be one guidebook for the set of programs that will be family support services. And then Joy, I don't know if you want to talk about the bigger picture.
Sure. I can add a little bit. To date, because our immediate goal is just to make sure there's no disruption in services on 9/1, most effort has really been focused on the logistics of this transition. But I think now that we're sort of just in the weeds of making sure staff have computers and access and those kinds of things, we are able to sort of start turning our attention to this bigger picture, the philosophy behind the continuum of care, and really start kind of thinking from an agency perspective, where do we want to go from here? After 9/1 happens, we need an idea, you know, like almost like a little roadmap of where we think we're headed. So, you know, we've been doing some efforts currently, like we just wrapped up, we did a series of what we called local continuum visits to go out to communities, bring together both PEI providers and existing HHSC providers to talk about what does this continuum look like on the ground? How are y'all working together? Where are the needs? Where are the pain points? How can we better support you? We've been talking with parent advisory councils and other like clients of our services. But I think as we move past 9/1, we want to formalize that a little bit more because I do think that our goal is to, whatever the strategic plan that we're required to do by SB 24 is, that Sasha, you know, she spoke to a little bit, really making sure that it speaks to this larger vision. And it's not, we don't want it to be focused purely on PEI. I mean, I think that would be counter to what SB 24 really wants for us. So it's still a little bit in flux, but we are just now starting to kind of think about, we have a whole, you know, blank slate, and what are we going to do with that?
And I didn't send you this question ahead of time, so I don't mean to put you on the spot, but I have to ask, like, are you also going to be looking at how the Thriving Texas Families and Family Support Services can work together? Because those programs have traditionally been pretty separate.
Yeah. I mean, it's been, Sasha, I'll go ahead and start. It's been an ongoing topic of conversation with Sasha and then her peer counterpart over Thriving Texas Families. How are these programs alike and how are they different and how do they work together? So I don't have a specific answer for you other than we know that that's something that needs to be sort of reconciled. We need to get clear on it so that we can clearly communicate it. But I do think that with Thriving Texas Families, you know, it is also up for reprocurement soon. The current contracts are about to expire, and so we're going to be reprocuring it with SB 24 in mind. And I think that gives us a really good opportunity to reflect on, you know, we have these goals in SB 24 we need to hit, but in light of PEI's move and this like goal for a more seamless continuum, how can we best use this program and best support the communities on the ground?
So I didn't realize that that was coming up for reprocurement. When is that?
I-
So
Don't quote me.
okay.
Kylene might know better, but I believe it'll post next year sometime.
Okay. Okay.
It's
great.
we're just starting the conversations about it.
Okay. Awesome.
And I was just going to add that, you know, without even a lot of strategic or state level planning or coordination, as often happens at the local level, they are way ahead of us in many places. So while I know not all pregnancy crisis centers are Thriving Texas Families, I know they are a huge referral source for home visiting now. And those, you know, like anywhere, sometimes some of our providers have bigger partnerships with schools or with local mental health authorities. But in many communities, a lot of the programs providing home visiting are strongly partnered with their pregnancy crisis centers and get a lot of referrals for services from those women sort of starting out there, but then wanting some more intensive support for a longer period of time.
Good. I'm going to switch up our order a little bit because I know Candace has a hard stop and has to leave at noon. So Candace Gray with Buckner Hope Center. Let's turn to Candace to talk about, because I think this is a good segue. Buckner recently, you know, we're a PEI grantee and have been for years. And we recently were able to tap into the Thriving Texas Families funding to serve more families. And so Candace can maybe talk about that in the context of the Family Hope Center. Are you here, Candace? I don't see you on the screen.
Yes.
Okay,
you hear
great.
me?
There she is. All right, tell us why you're in the car.
So we are just, you know, deep into summer programming. I am in San Antonio and we're starting a new Family Hope Center here. So we kind of gathered some team members from around the state. My car is trying to tell me something. Anyway, we tried to gather team members from around the state in order to support our team members here in San Antonio. So I'm in a t-shirt and in my car because we are doing summer programming right now. So.
Very good.
Yeah,
A couple of
yeah.
sports camps, if I'm right. So tell
Yeah.
us a little bit about Buckner and the prevention services that we provide at Buckner.
All right. So Buckner is an agency that has been around for over 140 years. We were started in 1879. We started off as a children's home, you know, an orphanage based in Dallas, Texas. But we have grown and evolved over that time. So we continue to do foster care and adoption as a part of our work, but we got away from, you know, an orphanage type model, and we got a lot more into family strengthening and family support services. So that's the area that I am responsible for. So we are doing we have one program that's family strengthening called Family Pathways, and that's where families that are getting their education live in our apartments. We have those locations in several places all over the state of Texas. So some of them get a 2-year certificate or degree, some get a 4-year degree, but it positions their family. It really changes the total trajectory of their family because they are then positioned to get increase their income and qualify for greater employment opportunities. It also has an impact as the children see their moms or their fathers going to school and furthering their education. So that's that program. And then as far as our Family Hope Centers, those are programs where we are community based. We are strategically located in communities because we typically serve low income families, and we are child centered, family focused places where families can come to get support and empowerment in their community. And again, our focus is on strengthening the entire family. So having like what we're doing today, where it's a summer camp for kids, but then also having adult programs, just having being able to surround the entire family with support services.
So from your perspective, how does Senate Bill 24 and the new changes, how does that affect organizations like Buckner, community organizations like Buckner?
Well, I mean, we are grateful for the support that provides us. It's recognizing the work that we've been doing for a long time on the ground with families, but it demonstrates that the state is now investing in those support. So so we're grateful for that and the option to continue to work, in partnership with those types of programs. And I forgot to mention that we also have other PEI contracts, or now I love family support services type contracts. We also have those in place. So we have HOPES programs in, I know, Beaumont and Longview. We have family and youth success programs down in the Rio Grande Valley and I believe Beaumont. And then of course we have Texas Home Visitation. It's going to be a new one that we're implementing, as well as Texas Thriving Families. So we believe this is critical work.
Yeah. And Fatherhood Effect. So
Fatherhood Effect, yes.
Quite an array.
Yes.
So on the Family Hope Center model specifically, so I know that we use evidence-based programming, but we also are really focused and have been on that poverty alleviation as well. Can you talk specifically about how you see Senate Bill 24 and its added focus on that? Is that supporting what you do, and how do you do that at the Family Hope Center? How are you focused on economic sustainability and stability?
Yeah, well, I'll just kind of talk about it in terms of our framework that we organize around engage, equip, and elevate. So we engage families through things like we might have a back to school backpack giveaway. We might have a summer camp. We might do all kinds of activities to just get families in the door and engage with them and get them interested in the other things that we are doing. And then the next level is equip. And that's more of an education and life skills equipping type emphasis. And so that is where we're doing job skills training. It may be soft skills. It may be a specific vocation that we are, where we may partner with a community college and provide some specific skills training. We're doing financial literacy so that family can make sure that they are have that skill set to manage the funds that are coming in. So we're doing those types of things to make sure that family is able to really be self-sufficient. That's our goal.
From your perspective, Candace, given this broad focus on strengthening families, what are we missing? What are the big needs that you're seeing out there in the communities that we just don't have enough services to address?
Yeah, I think mental health is a huge need that we need a lot more support for. Buckner does have some services in place for that. I was talking about our framework of engage, equip, and elevate. And one of the things that we're doing under elevate is providing therapeutic services for families. So we do that in our Family Pathways program. We do it through Family Hope Centers, and even through our other programming. So that's a huge area of need where we see the need for more investments in that. And then the other area I would say is even more financial strengthening. So where those families are able to have tangible opportunities for training, for placement and employment opportunities, or even also income generating activities. Because we serve families that are sometimes undocumented and may not be able to have traditional employment. And so just making sure that all families are able to earn a living and take care of their family.
Just one thing you wish the public and the legislative staff that are on this call and our HHSC leaders that are on this call, what is the one thing you wish they knew about the work in the community to help these families?
I loved something that someone mentioned, this concept of no wrong door. And I think that that's something that we are seeking to do internally. We talk about how important it is to have cohesive services. So, you know, because we know families may come to us at different points, like I was talking about our Engage events, they may come to us through that. They may come to a class first. They may come because they're in crises and they're needing that counseling service or whatever it is. And so I think, you know, just as we as an agency are seeking to be cohesive and be able to we call it a warm handoff. Even if we're going to refer internally, if we're going to refer externally, it's making sure that there's a warm handoff, that they're not going around pulling different doors, you know, up, that door is locked. Nope, wrong one here, wrong one there. That we really are family friendly, really are supporting them and being a cohesive system. So that would be the thing that I would say is so critical that we're seeking to do as an agency. And I love that, you know, others services and even through the state that's a goal.
Thank you, Candace. All right, I'm going to turn now to Kylene. Kylene Wright, who is with Texans for Life. Tell us a little bit about your organization, Kylene, and the work you do.
Well, our education does not provide services. We are about education and public advocacy for legislation that does protect babies and their moms. We learned early on in this struggle that the way to save the baby is to save the mom. And I would say that even a lot of the crisis pregnancy centers really have gotten away from the word crisis, that they really are more pregnancy help centers because their goal is to take away the crisis. And we want to do everything through our organization, through public advocacy, or just in our education work to make sure that these centers have what they need and have the increased public awareness that is necessary to accomplish their goals. And we're very, very excited about SB 24, and we're happy to advocate for that. Love the big idea behind it of a real effort towards family building, formation, and preservation. It's just so important. And what was the word you used? We're moving upstream. So it is very exciting.
Awesome. So tell us a little bit more about that. From your perspective, what does Senate Bill 24 accomplish with the Alternatives to Abortion program that needed to be done? What was the kind of the goals behind that?
Well, quite a bit, but one, we wanted to protect the fund, and this bill does that in two different ways. One, by moving it from an appropriation into legislation, certainly, but also the added accountability measures and goals is very important for continuing the work and for being able to make the case for them to continue receiving the funding. While most of these pregnancy centers have these goals, and many of them already have very robust programs in place working towards them, having it being part of your program goals and actually stated in your grant and in your outcome reporting just keeps the focus where we want it to be. And it also keeps out the bad actors. We don't really need call centers taking this money away from organizations that are providing these direct-to-material services. And we have had, a couple of bad actors in the program. And so we're very happy to have the added structure and accountability that was very much overdue for a fund that has grown so large and what is almost certainly the largest maternal assistance fund in the world. We want it to be in place to help our families for a very long time, and we want it to accomplish what it was intended to accomplish.
Awesome. Do you see from your perspective anything left to do? What are the gaps? Are there gaps in the Texas Thriving Families programs?
Well, I think that Candace brought up a very important point. When it became fairly obvious that jobs was going to come down and create major change in Texas for sure, we did do sort of a tour of pregnancy centers around the state. We kind of went to centers of different sizes, some that were newer, some that had been around for a long time, and in rural parts of the state, as well as major metro areas and things like that, to see where the gaps were. And mental health was a huge mention. I mean, these women who are coming to the pregnancy centers very often don't have any other support system. And very often that's been the case for a very long time in their lives. And so a lot of them have experienced all kinds of abuse and trauma, sometimes starting in childhood. And there are a lot of mental health issues. Now, some of your centers are paying for this privately. Prestonwood Pregnancy Center doesn't take any of the state money, but they have dozens of licensed professional counselors on staff and available to help these women. But that's a big part of family sustainability, of building your family, is being able to sort of sort out what was healthy and good in your own family and what you want to recreate, and how you can build a life and a family to minimize these traumas for your own children. So I think we have a ways to go on that. I think the pregnancy centers kind of know these needs, and it's triage. It's in your community. It's what is the biggest needs of the women right in front of you, and so and this one is just a little bit, I think, more expensive and can be a little bit more of a challenge to do, but it is critical to make these women whole and then make your families whole.
And what is one thing you wish that this audience and these HHSC leaders and the legislative staffers on the call knew about Thriving Texas Families? I mean, I think that this is a group of people that haven't been really, I'm looking at the list, it's mostly like, you know, people who've been part of Tex Protects and people in the prevention and early intervention space. What do you want us to know about these programs and their importance?
Well, I think one of the most important things, and something that is often misrepresented by other advocacy organizations and even in the media, is that care extends beyond infancy and beyond delivering diapers. Most of these pregnancy health centers provide assistance to a mother's older children as well. Probably 40% of their clients and patients have older children, and they're outside that continuum of care. And so a lot of times you even have the volunteers personally stepping up and assisting those older kids. So I would like for people to know that the notion that care just stops when they're not a baby anymore is not representative of these centers at all. And the fact that these centers are largely manned by women, and very often by women who face some of these struggles and are there because they have such a heart for these people. Many of them working at the centers are volunteers who want to make sure, a lot of them maybe feel like they didn't have a choice and want to make sure other women have real choices and are happy to come along and walk beside them. I think that it is just brilliant, the move, and really appreciate Chairman Frank and Colcourse for realizing that there was a little bit more of an adversarial look to having these programs in with CPS, and so moving them over to this friendlier looking organization or agency, and having these programs to integrate will be a huge boost to these moms and their families. So I'm very excited about that.
So we are going to open it up to questions, open the panel up to questions from the audience. So please put them in the chat, everybody. We've got Candace for just one more minute from Buckner if you have a question for her. But while we do that, we do have one. Colleen, you had mentioned call centers. Can you talk a little bit more about that? There's some confusion about what you meant by that.
Well, there was a grantee that was operating as a call center, and essentially it appeared from the perspective of pregnancy centers who were receiving referrals and things that they didn't actually provide any or many direct services of any kind, that their model was that they reached these really hard to reach women and sort of brought them in and then sent them to places around the state. And this fund was meant to support the moms and the families and those that serve them. And these pregnancy centers have very sophisticated outreach methods of their own. And so we did not see that as a good use of money. There was a lot of indication that some of the women receiving referrals and things that there was a lot of misunderstanding and miscommunication. So you had this extra layer that whether or not it was true that they were giving misinformation, there were people who were misinformed and were angry when they went to it. And so it was just a layer that we did not need to be funding.
Appreciate that. Any other questions?
I
We all
was
have
just
questions
gonna-
for each other. We might have questions for each other.
I was just going to chime in. There's a comment. I don't know, Beverly, if you necessarily had a question in this, but I think what Beverly put in the chat is a good point to make. You know, whenever you're thinking about, you know, caregivers that have been foster parents, or have worked kind of in that more formal system, how there's kind of access to services and somebody that's actually kind of helping navigate that. But really, whenever you kind of step more into this informal space, right, where they're you know, there's not the formality, right? Like, so it's just a different, I don't want to say it's a different bucket of services, but it's trying to navigate those things and trying to make sure that they have their needs met. So Beverly, I don't know if you had a question somewhere in there, but I appreciate the point you were trying to make of like kind of difference in navigation, you know, between these different agencies.
Absolutely. And I will stress that I know Candace had to go, but Buckner serves a ton of kinship families in our Family Hope Centers. And that should be, you know, serving those families should absolutely be part of the upstream work, right? Because those families, if they don't get the help they need to be strong, given the disruption that's already happened, then we're looking at another CPS case, or we're looking at a dissolution of a placement. And so that's a really important part of this. And we actually really want to get the word out to more kinship families that this is available to them. This is not just for bio families. These services across the spectrum, and I think you would agree, Sasha, like and Joy, in the Family Support Division and in Texas Thriving Families, there was a new addition to that to serve families who adopt a child and who are taking care of a child, right, at any age. So that's a big part of this upstream movement. There's
another question. There's another question in here. Lynn Gibson with Reese Jones in Dallas put, you know, we talk a lot about moms. Dads seem to be largely an afterthought. What efforts are being made to engage dads more in the lives of their children? This seems like an important aspect that is often overlooked. Sasha, I don't know if you want to jump in here and talk about fatherhood effect. You know, I'm not sure. Kylene, if you might also want to chime in too.
I would love to address that a little bit.
You go first.
Okay. I mean, obviously, it's typically the mother that comes into a pregnancy help center looking for help. Sometimes the father is with her, but that is something that every pregnancy center I know of, going back to the very beginning of these organizations, has seen as a real important thing to try to bring in her family and the father. And a lot of these pregnancy centers have extensive outreach and even staff and programs dedicated to the fathers and helping them also with job training and financial help. And so that and the family formation accountability goals in SB 24, I think will further incentivize and support that. Sometimes these programs are difficult. If, I think, Beverly would understand this. If you single parented kids, you understand how difficult it can be to go to extra programs, particularly if you are already working. And so not only do these centers have to provide these programs and provide them at times when it's a little bit harder to get volunteers and staff to come, maybe nights and weekends, but they typically also have to provide childcare for the other children. And they also tend to incentivize attendance with maybe dinner gift cards and things that, further help her or him, the father, prioritize this, because they're going to get this extra help. You're going to be able to go buy dinner the next time. You just cannot cook. You're so tired, that sort of thing. And so to have the state come along and have this be part of the goal and part of the programs, and to have all your new programs not have to be evidence-based, to give you the space and the freedom to identify specific and maybe a little bit different needs in your community and to develop a response to that, I think is going to have a huge impact upstream and down the road.
Well, of course, I couldn't agree more. I think anybody who's seen me speak knows how much I feel about involving fathers, and we've had a fatherhood program, which I know Buckner is providing, and learned quite a bit about reaching dads. But it all started, of course, because we just came across research about how much better off kids are when their fathers are involved in their life, even if they don't live with them or aren't, but just co-parenting from whatever situation happens to be the case. And so that extends well beyond just the fatherhood programs we're running, but we also encourage all of our programs, I think, to involve fathers. And what we've learned is that it's really systemic work where fathers are mostly impacted, just hearing the message that they matter, and they matter as a unique type of parent to their child, and that they matter in the support they provide the mother. And so to that end, it's broader than the PEI programs. There's programs, WIC clinics in particular have been a huge participant in a lot of the fatherhood conferences that we've had, because of there's a lot of research about how breastfeeding is better supported when fathers get involved and support moms, and et cetera, et cetera, et cetera. And so they've come up with some really innovative ways to encourage father participation. And one I heard was, that they gave like a charm bracelet, and every time the dad came to a session, they'd get another charm to give to the wife. It was like a huge hit. So lots of innovative ways. And then of course we've single fathers, and we've been doing part of the sort of like ramping up to this strategic planning that we talked about earlier was both the PEI leadership, Sarah and I, and sometimes with, and even beyond that, the Family Health Services. We've all been doing our listening tours of going out and visiting with programs. And I was in Abilene and heard, this is, anecdotal, but that they felt they were seeing a lot more single fathers lately, raising kids, and that the moms had either taken off or maybe were incarcerated or dealing with substances or some other type of difficult situation. And so those single dads feel really marginalized, and we want to make room for them. So it's sort of like, it's work on all levels. It's work about trying to have fatherhood work for fathers in particular, but it's also about wherever parents are being supported, that fathers feel welcome and that they're encouraged to be active in their child's life, and that their role extends beyond being a financial provider. And Joy, I know, I mean, I'm still learning all the other FHS programs, and I'm sure fathers are involved in more than WIC and ECI. So please add.
Yeah, absolutely. I think this is one of the areas that there's a lot of opportunity. We administer programs that serve men, and I don't think people realize that. A lot of our healthcare programs are inclusive of men. And so what I really want to look at is if we can open up the pipeline, the referral pipeline between these programs that are really oriented towards families, of which men are a huge part, and these services for men. I would love to see us able to actually serve fathers, not just as fathers, but really help them be able to address their own health needs. The healthier they are, the easier it's going to be for them to be present and available as a father. So that's the only other thing I'd add, is just, I think that's a really exciting opportunity to connect men into our healthcare programs who they may not currently realize they have that option.
Super cool.
And something I would like to add, at least for Text Protects, we've been, talking a lot about what our legislative agenda might look like for legislative session. And one of the things that, we have been focusing on and considering is, with this historic $65 million that went towards prevention services last session, one of the programs that did not get an increase to expand more services is the Fatherhood Effect program. And so Text Protects, we do have that on in our sites to ask for additional funding for that, so that we can continue to focus on fathers. So I just wanted to go ahead and chime in and say that while we were talking about it.
We have a couple more questions. One is, how is PEI staying in touch with CPS or the SSCCs to become aware of what the families in need of those services? What's the referral process? How's that going to work when it's moved over to HHSC?
Yeah, I'm happy to speak to that. I mean, first of all, there's always been a pretty significant firewall, if you will, between PEI services and CPS services. Like, the data we collect on families just in order to track outcomes and is completely unavailable to CPS. And we don't exchange data because those families they're engaging voluntarily. The CPS can refer to PEI programs like any other community provider. So there are CPS referrals, but they're not facilitated by PEI or by the state agency. They just happen at the local level, the way CPS might also refer to a mental health authority or might refer to the WIC clinic. So that is really all handled at the local level between regional staff and the grantees who run the programs. So in many ways, I don't expect anything to change in that regard. But when it comes to tracking trends and sort of being aware of what issues might be leading families to such a crisis stage that they might need intervention by CPS or might get a call to the intake hotline. I mean, there's a couple of things. We will still, Senate Bill 24 gave DFPS the permission to share data with us, so we can do data matching and track trends. And again, it's not that we're sharing our client data with CPS at all, but more that we can see if our clients are either engaging in CPS down the road, and I think to do collaborative work around these types of trends. And I was just talking to Commissioner Muth about this last week about, and this will be something, of course, that HHSC will facilitate, I think, but that it really is exciting to create maybe a little bit more of an intentional partnership between DFPS and HHSC, because the legislature clearly sees HHSC as the provider of services for families, and CPS, they want CPS's role to be very, very limited to just this intervention in the case of abuse or neglect, and to really get the heck out of a family's life if there isn't really reason to remove a child and place them in care. And that means that HHSC is really the one there for all the other families and all the other circumstances. And a lot of families that, where there's calls, I think Adriana was talking about this earlier, is community partners that are just concerned about a family and they don't exactly know how or what way would be helpful. And I think everyone would rather, if they can, refer to something more helpful than something maybe kind of scary or threatening or as intrusive as CPS. Not that, I mean, that's needed when it's needed. And I think this is a real opportunity for CPS to share more systemically, not just the issues it's seeing with the kids, which are its primary focus, right? They're the parent of a lot of children who've gone through a lot of trauma. But beyond that, they're investigating families and often closing cases or referring to supports. And they have a unique perspective of what families might be struggling with, particularly around substance use and mental health concerns. And I think to be able to care, and again, that's not anything PEI was really supporting anyway. So that was something that was always coming out of the behavioral health area of HHSC. And so for there to be a stronger connection and for DFPS to be able to say more periodically, look, here's what the adults we're seeing are needing from HHSC. And here's the array of services that maybe we think could have helped earlier if those supports had gotten there earlier. I think it's a really exciting opportunity. And I think something, Joy, I don't know if you want to speak more broadly to where you see family health going in that arena to sort of tackle that broader perspective of families' needs beyond the parenting supports that Family Support Services offers.
Yeah, I mean, I think that that's sort of what we're trying to figure out as we think about this continuum, understanding that, yes, there's this parenting need, but so much goes into feeling like you can be an effective parent, right? And what are all the different needs and considerations? So almost, I mean, I personally sort of have been taking a Maslow's hierarchy of needs approach, right? And if being a really confident and effective, feeling like a really confident and effective parent is sort of that like top of the iceberg, what are all the pieces you need as a parent to even be able to focus on how you're disciplining your child or how you're engaging with them in a positive way or how you're enforcing screen time limits, those kinds of things. If you're focused on where am I getting food, how am I going to afford the medicine, how am I even getting to, the pediatrician appointment, all of that is going to come first before you even are able to focus on some of those other things. So I think that's where family health services can really help as we're looking at what this continuum means. How are we leveraging the PEI programs to address parenting support and some of these other areas, but where do other family health programs fit in? But also, HHSC administers a bunch of different services outside of family health. So how are we engaging with, like you mentioned, the local mental health authorities to better serve kiddos and all of those other services? How do they all fit in together? I think that maybe answers the question.
Now, it sounds like there's a lot of planning happening and upcoming opportunities for really making this all fit together to serve families better. One question we had was about, the whole no wrong door, and how do we make sure that families are getting where they need to go, getting the services they need, and specifically, how does that align with the Help Me Grow initiative, especially since that's not statewide currently? Are there any conversations about that, about making sure that families are able, and folks who want to support families are able to connect those families to services?
I mean, Help Me Grow is one great framework, I think, for doing that, although that is sort of, more focused on young children or parents of very young children. Although I know in Tarrant County, they're sort of trying to create a model for older children as well that kind of mimics the Help Me Grow. And that's what communities do. I mean, they sort of make it happen. And that's been, at least the perspective of PEI has been that the community organizations better know how to sort of present these programs to communities. I mean, to parents and families. We've never created like a call center specifically or a systemic way to get to families, because we know it looks different in every community where families are more comfortable. And we sort of look to, it's why we grant the funding to community level organizations, and those that win the grant are the ones that make a convincing argument that they are connected to community, connected to families, that they know what families need, or that they know a way to approach them. And that is part of what we're sort of getting in that partnership, is that perspective that we don't have at the state level. So I think it varies, and it varies from community to community and from different communities within community. It's one of my favorite questions, is what is community? I mean, so I think, who parents trust is all over the map. And so you're never gonna find just one place where, I mean, pediatricians I think we spent like 3 or 4 years thinking it's the pediatrician, right? That's the trusted source for families. But then we quickly learned, like, pediatricians don't have a whole lot of time. They have maybe 10 minutes. And that actually parents want to get an A when they go to the pediatrician. They want that gold star, so they often don't disclose that they, or maybe don't understand what the pediatrician just told them, or that they're not sure, or that they're struggling. And so lots of assumptions we've made over time about where parents might get information, or get or trust a referral or a suggestion to go, have always been right sometimes and wrong sometimes, or right for some people and wrong for some people. So I think we're all wanting answers to that magic question, and I think it's just going to always be a work in progress, and something that starts at the actual parent level and asking them.
And deferring to
Yeah, go ahead.
people on the ground who have already learned through trial and error what works for their community.
Yeah, that's a tough one. I think we have a webinar coming up about that, about connecting families that
We sure do. Thank you, Andrea. I'll talk about that in just a moment. I think we have time for one more question, and Amanda had a couple questions, so maybe we can get at one of those in the next 5 minutes.
Yeah, I was going to ask about the rural community question, because that's a huge one. Texas has a ton of rural communities. We're very big. There's not a lot of public transportation. There's just a lot of challenges. And so how are y'all having conversations about reaching rural families, and how do you see that playing out, both on the Thriving Texas Family side and the family support side?
Now, Kylie, do you want to take that one first?
Sure. The biggest problem in rural communities is healthcare providers. Most of them employ nurses, nurse practitioners, or doctors when they can find them. And so that's a big challenge. What I have seen with a number of them in West Texas and places where it gets really rural is they will open for a day a week or 2 days a week in some of these smaller communities, wherever the hub of this small community is, to make it more accessible. But we just have a shortage of healthcare workers, and particularly, I guess, in the OB-GYN field, and particularly in rural Texas. And as you mentioned, it's very big. We have a lot of rural Texas, everything beyond the I-35 corridor, basically, on both sides.
I know that's one of our focuses in our strategic planning, is to start looking at our rural communities. And while we're technically serving them in many places, I mean, or at least our service providers are available to residents of those counties, it doesn't necessarily look that way often to clients, because maybe the office is in a hub 75, 100 miles away. And so a lot of one thing PEI programs have always done, even beyond the home visiting programs, but even phase, is that providers do drive to the family's home. So that is the way they deliver services. That's been one way we've tackled that. We all learned about providing virtual services. So that's been one help recently that's come along. We've invested, and it's not our idea. Our grantees in some of the expansion have asked for funds to lease vans. So we've seen a lot more mobile family resource centers, mobile family support services, take programming on the road beyond just an individual going to visit an individual family, but maybe go to a public library in a small town for one day a week, or just make scheduled stops. And I know that that kind of mobile provision it happens in lots of other HHSC programming too. So when I was in Lubbock, I was talking with our nurse family partnership providers there, which happened to be Texas Tech, and at least Texas Tech as a healthcare system had mobile, they had clinic vans. It wasn't just for NFP, but they had it, it was the first place I heard like a solution that happened to be working, was that they were like, we just have vans to pick people up and get them to their healthcare appointment. So I think we're just also like taking notes about strategies that seem to be working in other communities and sharing them. I've heard lots of our providers trying to contemplate exactly that, like creating a bus route or like buying a van and trying to pick clients up. There's a lot of logistics involved in that and liability, but people really see that transportation, childcare, mental health, those are some of the biggest housing. Those are some of the biggest needs that we see, but particularly in rural communities.
Yeah, the last thing I'd add is just in terms of the Texas Prevention Network, we are, that learning community is really just stepping up and learning from each other. And so we are actually seeing a lot of providers, rural and urban, communicating and sharing best practices with each other, and even those that serve urban communities that are stepping up and serving the suburban surrounding communities where a lot of folks are moving because of cost of living, right? And so you have a lot of poverty surrounding urban core centers, and a lot of infrastructure or services in rural, less resourced communities. And so we are seeing a lot of providers learning from each other at the Texas Prevention Network, and we'll continue to emphasize rural communities and that kind of connectivity. So great question, Amanda. I think we want to give a round of like virtual applause to our speakers today. Thank you for being here. I know I myself learned so much and was really excited about everything that we have in front of us with all this PEI transformation and transition over to family supportive services. It really is such a terrific time for us to look forward and start planning together to be more for our families and children. So it's really an exciting time. Thank you again to all of you. And thank you to Andrea, our fearless board member and policy chair, for facilitating the conversation. We wanted to, before we left though, remind you that we have 2 more terrific learning opportunities later this summer. Both of those will be virtual, similar format. We ask that you register. We'll be sending out these as we did this one, we'll be sending out advertisements and promotion for these. The first one really is on strong extended families. And we talked about, several of you in the chat talked about the importance of kin and kinship providers, in particular, informal kin and the role that those are playing. We know that we need to focus on how we can expand legal services and support for the aunties and the abuelas and all of the family members that are stepping up to support the children that are in need. And so we're going to have a session on August 29th, focused specifically on that. We would encourage you and welcome you to attend to learn about what policy opportunities we have to support those extended families. And then our last learning session focused on policy opportunities related to families this summer is on September 26th. And that, as Andrea mentioned, really is going to be more about how you connect families to services. All of these wonderful programs that we've spoken about today, they all exist in many places, but they're not going to they're not going to mount to anything if the families don't know about them and can't connect to them. And so that infrastructure piece is very important. Not as fun to talk about because it's not as fun to talk about if you're not serving families, but if we really need to get those connectivities out there, so whether it's a Help Me Grow framework or 211 or whatever it is, we need to make sure that families are connecting to resources, or Family Resource Center, I guess I should also say. So come to our last session, September 26th, and learn more about all the different ways that counties, communities across the state in rural and urban centers are creating opportunities to connect families with resources. That is it. I'll put up the last slide. Brianna, can we go there just to say thank you? We look forward to seeing you on August 29th. Thank you again to our speakers. We'll be following up with the slides and with any resources. So thank you again for being here, and feel free to reach out if you have any questions. Thanks again, everybody. Thank you, Joy. Thank you, Alex. Thank you, Ian. Thank you, Amanda. All right, Carrie, I think you can close out. Thank you.